Hello, everyone, and welcome to the Medical Podcast. In the next few episodes, we'll be talking about a very serious disease that claims many lives each year: congestive heart failure.
Congestive heart failure is a long-term condition that occurs when your heart is unable to pump blood at the level which your body requires. Your heart still works during this disease, but as a result of it not being able to pump enough blood collects in other parts of the body, such as the lungs. The heart is not able to pump enough blood during congestive heart failure due to the heart muscles either being too weak or too stiff, and weak to pump the proper amount of blood.
Some causes of heart failure are heart attacks, diabetes, kidney disease, high BMI, tobacco, alcohol, certain medications, and high blood pressure. Symptoms of heart failure include shortness of breath, chest pain, heart palpitations, a dry and hacking cough, swelling in the ankles and legs, a bloated or hard stomach, and loss of appetite. Heart failure has many risk factors, such as being over the age of 65, smoking and drinking, having an inactive lifestyle, family history of congestive heart failure, high blood pressure, and eating food full of sodium and fat.
In order to teach you listeners about congestive heart failure, it is first mandatory that we describe the anatomy, physiology, and pathology of this disease. Congestive heart failure takes place in chambers of the heart, as heart failure occurs when the four chambers of the heart fails to pump blood at the pace that the body needs.
During congestive heart failure, the heart muscles have reduced contractility, which thus produces a reduction in cardiac output, which then becomes inadequate to meet the demands of the body. Congestive heart failure occurs when there are changes to the structure of our heart muscle, and it cannot pump as effectively as it should.
It is important that all of you, our viewers, prevent congestive heart failure, as this disease infects close to 6 million people a year and has a mortality rate of more than 50%. You can prevent heart failure by not smoking or drinking, treating any potential high cholesterol, regular exercise, staying at a normal weight, and treatment for high blood pressure.
It is important to prevent congestive heart failure as the mortality rate is very high and the hospital bills are even higher. Only 30% of people survive longer than 10 years if they experience congestive heart failure, and that 30% has to be on medication until the day they die. There is no cure for heart failure, so if you get it, you have to stay with it. Due to all of that, it is mandatory that everyone tries to prevent heart failure as effectively as they can.
That's all for this episode. See you on the next episode of this mini-series about congestive heart failure exclusively on our podcast, the Medical Podcast.